So Erin, do you have anything that you'd like to add regarding the potential advantages of long-acting injectable medicines?
Yeah, well, there's the obvious that there's no pill to remember to take, right? And that is a huge advantage, especially for some of the oral antipsychotics, or rather over some of the oral antipsychotics that have food intake requirements or are dosed multiple times per day. And those become very complicated medication regimens when we're asking for adherence. And especially if we've already reached someone that's had some cognitive decline that Henry has spoken so much about, the more complicated we make it for them, the less likely they are to be able to be adherent. Secondly, as a healthcare provider, we know that if the injection was missed, that they're going to decline, and we can know if it was missed because it's administered by a healthcare provider. So they either show up for it or they don't. And if they don't, we have a wonderful opportunity to reach out to them, to try and contact them or other members of their treatment team to try and get them in to the clinic or into the pharmacy or wherever it is that they're receiving their injection as soon as possible after that missed dose. Again, this is going to help to maybe prevent them having to restart it, or prevent them from having a relapse that might lead to a hospitalization or incarceration or some kind of harm to themselves or others. Anecdotally, I would say that even if we're talking about the oral form of the same injectable medication versus the injectable itself, many of my patients report that if they were having any kind of a side effect on the oral antipsychotic, that once they shift over to the injectable form, that side effect often is reduced or completely eliminated from their side effect profile. And so this encourages adherence as well. It's now become not only more convenient, but more tolerable. And anytime we can combine efficacy with tolerability, we're likely to have a better outcome.
Let me add to what Erin said. There are numerous advantages for long-acting injectables. I categorize them as biological, clinical, social, and financial. Let me elaborate on each. Biological, you save the patient massive brain tissue loss. Every psychotic episode, starting with the first one, patients lose about 11 to 12 cubic centimeters of brain tissue. It's been published and replicated. Each cc contains hundreds of millions of cells. That is very important. The long-acting injectable will spare the patient, most patients, spare them the relapse that will destroy their brain and lead to disability. Second, the clinical benefit. Every time the patient relapses, the brain, because of inflammation and free radicals that are destroying brain tissue, will develop treatment resistance. This has been shown repeatedly and published repeatedly. With every relapse, you need higher and higher doses, if at all. Sometimes they stop responding completely. Dr. Emsley in South Africa had a very nice study where the patients were given long-acting injectable first episode, and 65% of them did great. And when they were sent back to their physicians, psychiatrists, they put them back on oral, and all of them relapsed within a few months. And so when they realized that what they've done, they put them back on injectable, and 17% of them never responded again to the injectable Risperdal Consta, I think it was at the time they used back in 2006. 17%, 1 in 6 patients never responded again after responding for 2 full years. The clinical resistance, the medication resistance develops with every relapse. So we spare the patient that. Third is the social consequences. You're talking about incarceration right and left. 2 million people in the United States with schizophrenia have been incarcerated in the last year or two. That's terrible for the patients to be criminalized and to be treated like trash in the jails, and sometimes not even given the medication, and then they're discharged with hardly any pills. Go find yourself a clinic, and the recidivism is enormous. That is a terrible consequence of relapse. Whenever patients become psychotic, they do something erratic on the street, they get shipped to jail, and because there's no more hospitals to take them to. So that is another thing we can spare them. And then the financial advantages is for the system. We mentioned earlier how expensive schizophrenia is. It's one of the most expensive disorders in medicine. 20% of all social security disability for 2,000 diseases in medicine. One disease, schizophrenia, gets 20% of all social security disability. The indirect cost of supporting the patients for the rest of their life is unbelievably expensive, much more than the direct cost. And so we as the taxpayers who are supporting the patients through Medicaid and Medicare, as we mentioned earlier, can save a lot of money by preventing the inpatient hospitalization, which is the single greatest cost in patients in schizophrenia, much costlier than any medication we give them, oral or injectable. And so by saving this amount of money, we can channel it into some other healthcare initiatives and social programs that are badly needed, instead of continuing to spend $100 billion a year on schizophrenia. Those are the 4 advantages that apparently many clinicians don't seem to have on their radar screen. And it's just an option. We don't even know if the patient wants it or not. They should pursue it as aggressively as possible. And I tell my patients, if you were my own son or daughter, this is what I will do for you. I want to treat you like a family member. This is how you convince the patient compassionately that this is the best thing that they can do.